Max, and I'm ages 7 years old. I like to cook. I like playing piano.
Max was still a baby. He was 7 months old, and his pediatrician, only when he had a fever, could hear something, which we now know is very common with this actually, because your heart rate speeds up when you have a fever. So we would go in for a well check, and she'd be like, no, I don't hear it anymore, and then we'd go in for an ear infection, and he'd have a fever, and she'd go, I don't know, I think I hear something, So finally she just said, I think we just need to go check this out. He was doing an ultrasound of his heart just to check it out. EKG was fine, hooked him up to the leads, and everything looked okay. We said, let me just take a look. And I saw the look on his face change as soon as he saw it. And it scared me to death.
Wait, 1, 2, 3, 4.
There you go. The first thing he said was, do you have a history of hypertrophic cardiomyopathy in your family? And I said, I've never heard of that. I don't even know what that is.
Kind of speedy on your math today.
My head is just spinning, and I'm just very upset and scared. And he said, you're going to go home and you're going to Google this, and it's going to scare you to death. And I want you to know that that is not going to be Max's reality. We know about this, and we're on it, and we're going to keep him safe.
That word is needn't. That's kind of a weird word.
Max is really lucky so far. He doesn't have any outward symptoms of this condition. He may end up on medication, probably will at some point. Especially the older he gets, should not play contact sports, should not be out in the heat. Right now he can do whatever he wants to, but when you get into sports more in the high school, college years, that's when coaches are really sort of pushing them and trying to get the most out of them that they can, which is appropriate for an athlete, but is dangerous for him. So we've tried to steer him toward activities that are safe for him, things that he can do his whole life. And on his own, he has recently discovered theater, and we were thrilled with that.
Got to take direction. You've got to have.
My advice to parents would be, if you know of anyone in your family that has had a catastrophic heart attack at a young age, definitely get checked out and get your children checked out, because it is so familial, and it's just important to know. It's the kind of thing where it's really scary to know about it, but if you know about it, there's a lot you can do to keep your children safe.